Hello, gentlemen. If you're over 50, 60, or beyond, and you've recently found yourself in that moment, you know exactly the one I'm talking about. You're turned on, you're in the middle of intimacy, and everything is going perfectly well. But somewhere along the way, it just fades away. The firmness disappears, and suddenly you're left standing there feeling embarrassed, completely frustrated, and maybe even questioning what's happening to your body. Perhaps it happened just once. Maybe it's happened several times now. Or perhaps you've started quietly avoiding intimacy with your partner altogether, because the fear of it happening again is worse than the disappointment itself. If those thoughts have crossed your mind, I want you to hear this clearly. You are far from alone. This is one of the most common things men in my practice bring up, and I promise you, it is not a reflection of your worth or your masculinity. I'm Dr. Claire Morgan, and today we're going to get straight to the point. We're going to break down exactly why this happens and, more importantly, what you can actually do about it. Stay with me, because some of these reasons genuinely catch my patients off guard, and understanding them might just change everything for you. Before we get into it, let me ask you something. How old are you, and where are you watching from today? Drop your age and your country in the comments below. I genuinely love seeing men from all over the world connecting here, realizing they're not the only ones dealing with this. Now, before we can fix the problem, it helps to understand the machinery. Think of an erection like inflating a tire. When you're aroused, your brain sends a signal that tells the blood vessels in that area to open up wide. Blood rushes in, fills the spongy chambers, and at the same time, the exit valves clamp shut to trap that blood inside. That trapped blood creates the pressure that keeps you firm and ready. It's a simple inflow and outflow system. When you lose an erection midway, it means something is interrupting that process. Either the blood isn't flowing in fast enough, the vessels aren't staying open wide enough, or the exit valves are letting the pressure escape too soon. Every single one of the 6 reasons we're about to discuss messes with this balance. Let's start with the biggest and most serious one. Your body's plumbing is the foundation for everything. The blood vessels that supply your penis are actually about half the size of the ones that supply your heart. Think about that for a moment. If your pipes are starting to get clogged or stiffen up, you're going to notice it in the smaller pipes down there long before you ever feel anything in your chest. This is why I tell my patients that their erections are a window into their overall health. It's like a warning light on your dashboard. Many men walk around with silently rising blood pressure, creeping cholesterol, or blood sugar issues without ever knowing it. These conditions slowly damage the inner lining of your blood vessels over the years, making them less flexible and less able to open up when you need them to. And because you don't feel any pain from these conditions, they often go completely untreated. Here is a reality check that might surprise you. A significant number of men who start having these erection issues will go on to have a heart-related event within the following years. That is not meant to scare you, but it is meant to wake you up. Your body is talking to you. If you're struggling, it is absolutely vital to see your primary care doctor. Don't brush this off as just part of getting older. Get a proper evaluation to make sure your heart and circulation are in good shape. A simple checkup could literally save your life. Now, let's move on to the second reason. And this one is all about what's happening between your ears. Your brain is the most powerful sexual organ you have, not your penis, your brain. I tell all my patients that the very first time you lose an erection, the problem instantly becomes partly psychological. Not because you're crazy, but because now you remember it. You go into the next intimate moment, and that little voice in your head starts whispering, is it going to happen again? What if I lose it? Am I doing this right? Before you know it, you're not in the moment anymore. You're watching yourself like a spectator. That anxiety triggers your body's fight or flight response. It's the survival mode that pumps stress chemicals through your system. And what do those chemicals do? They clamp down your blood vessels and force blood away from the surface and into your core. It's the exact opposite of what you need for a firm erection. You get stressed, you lose it, you get more stressed, and the cycle just gets worse and worse until you're completely trapped in your own head. So how do you break out of that vicious loop? The first step is talking to your partner. I know it feels awkward and uncomfortable, but silence is what gives the anxiety power. When you say it out loud, you take away its grip. Tell them you're feeling pressured or nervous. Often, just having that conversation releases a massive weight. The second thing I often suggest is to take penetration completely off the table for a while. Focus on being intimate without any expectations. Touch each other, kiss, massage, just enjoy the sensation of skin on skin without any goal of finishing. Slowly, as the pressure disappears and your confidence starts to rebuild, you can work your way back. And if you need a little extra help to break that cycle, there are safe, proven options that your doctor can discuss with you to give you that initial boost of confidence. Once your brain realizes everything is working again, you often don't need that help anymore. The third reason has to do with sensitivity. As we get older, the nerve endings in the skin become less responsive. They just don't send as strong a signal to your brain saying, hey, we're being touched here. When your brain isn't getting those strong signals, your arousal level drops and your erection follows right behind it. But here is something most men don't realize. Your nervous system has different pathways for different kinds of sensations. There's the usual touch sensation, but there's also pathways for vibration and for temperature. So when the usual method isn't working as well as it used to, you can wake up those other routes. Try introducing different kinds of stimulation. Experiment with varying the pressure, using a warming massage oil, or even cooling sensations. Light, teasing touches with a soft fabric can also activate nerve endings that have gone quiet. The key here is novelty. When you've been doing things the exact same way for decades, your brain gets complacent. Shaking things up with new sensations can reignite the arousal that's been fading. The fourth reason is surprisingly simple, and yet so many men overlook it. You just aren't fully aroused. Society expects men to be ready to go at the drop of a hat, but that is a terrible myth. You are not a machine. You need mental and physical preparation just like anyone else. If you're rushing through foreplay or your partner is rushing you, you might be starting penetration with only a partial erection. That partial erection is fragile. One slight shift in position, one distracting thought, one pause to adjust, and it can vanish completely. The solution here is to slow everything down. Spend more time building up to the main event. Focus on each other without any hurry. Make sure you feel that peak of arousal before you even think about moving forward. Variety matters too. If you've been having sex in the same place, at the same time, in the same position for years, your brain is practically asleep. Introducing novelty isn't just fun, it's actually medicinal for your arousal levels. Now, the fifth reason is a hidden culprit that often gets overlooked. It's your prescription medications. Many very common medications have side effects that can interfere with your ability to get or keep an erection, and most men are never warned about this when they're prescribed them. Certain drugs that help with mood, blood pressure, or even some over-the-counter options for congestion can throw a wrench into that delicate signaling system we talked about earlier. Now, I need to be very clear about something. Please do not stop taking any prescribed medication on your own. That can be extremely dangerous, especially if it's for your heart or your mental well-being. But you absolutely need to have an honest conversation with the doctor who prescribed them. Let them know that this aspect of your life is important to you. Ask them if there might be an alternative option or if a dose adjustment could help. Often, there are other choices available that won't affect you this way, but you will never know if you don't bring it up. Doctors are there to help you, but they can't read your mind. Finally, the sixth reason is the one that catches almost everyone completely off guard. It's what happens while you are sleeping. It's called sleep apnea, and it is vastly underdiagnosed in men over 50. If you snore loudly, if you wake up exhausted no matter how many hours you slept, Or if your partner has ever told you that you stop breathing or gasp for air during the night, listen up. Here is what is happening. When you stop breathing, even for a few seconds, the oxygen level in your blood drops. Your body panics and releases stress hormones to wake you up enough to breathe again. This happens dozens or even hundreds of times a night without you even knowing it. These stress hormones are the same ones that constrict your blood vessels and suppress your natural hormone production. Over time, it creates the absolute perfect storm that ruins your erectile function. Many men spend years blaming themselves or their age, only to find out that the root cause was a lack of oxygen during sleep. The good news is that this is treatable. If you recognize any of those signs, talk to your doctor. There are straightforward solutions that can help you breathe properly at night, and countless men find that once they address their sleep, their erections return, their energy skyrockets, and their overall health improves dramatically. So gentlemen, let's bring all of this together. Losing an erection in the middle of sex is incredibly common. It is not a failure. It is information. It is your body trying to communicate with you. Look at the pattern. Is it related to stress and anxiety? Is it linked to your medication? Is your sleep a mess? Or is it time to check in on your heart health? You don't have to figure this out alone. Please do not suffer in silence. Too many men carry this burden quietly for years, feeling a deep sense of shame. There is no shame in asking for help. There is no shame in seeing your doctor and getting a real evaluation. You deserve to understand what is happening in your body. You deserve to enjoy a fulfilling, confident, intimate life at any age. If you found this discussion helpful, please take a second to hit that like button. It helps YouTube show this to other men who might be quietly searching for these exact same answers. And if you haven't already, hit subscribe. Every week, I bring you honest, straightforward conversations about men's health after 50, cutting through the nonsense and giving you the facts. I'm Dr. Claire Morgan. Thank you for watching. Take good care of yourself, and I will see you right here in the next one.